Remember this sign, plan ahead, and how the writing doesn't quite fit on the page? Well, or if it doesn't very well. Well, it appears that the same thing is happening with the Affordable Care Act. With all the new, like 50 million new patients added to our healthcare system, and there aren't enough healthcare workers, and there aren't enough primary care physicians, I mean, what's going to happen? It doesn't seem like they planned ahead.
Well, we're doing the best we can, and I'm glad that we've got care now for indigent people that we didn't have before. That's the beauty of ObamaCare, of the Affordable Care Act, is that people who don't have health insurance now will have health insurance. But you're right, it raises a new problem. And that problem is where are we going to get the physicians who will take these patients, because the reimbursement fees for it are going to be low. And doctors have bills to pay too. And they're not going to be able to just cut their income without having to make some planning ahead themselves.
Well, the way I see it is that it looks like the whole healthcare system is going to be diluted, because we have the same number of healthcare providers and so forth, and we have 50 million new patients that are being added to this system.
And in addition,
so where are they going to be seen? They'll be seen probably in the emergency rooms and the
still, it depends on how
care.
Depends on how things are adapted. The other thing is there's going to be a limited amount of money, and so you're right when you say care is going to be diluted from that point of view too. But what's going to inevitably have to happen is that more doctors are going to have to be involved with either working for the government, or working for an HMO, or working for a state organization of some kind, so they're on salary. But doctors on salary, they're not going to care too much about what the company is charging each particular person who's asking for services.
Well, one of the things that's happening is that they're reducing the benefits of Medicare so that it will look a little bit more appealing for taking Medicaid patients.
It's going to be an interesting way that you said that, because basically what's happening here is that if we are going to lower reimbursement fees for Medicare, it's going to be more in line with the rates that are charged for Medicaid. And right now, a lot of doctors won't take Medicaid patients because of the low fees, but they will take Medicare patients. But as that equalizes out, the private practitioner is going to be less inclined to turn away patients who are on Medi-Cal or Medicaid.
And they're also going to be less inclined to maybe suggest anything a little out of the box, because it's going to be all conventional medicine with pharmaceutical drugs. And as far as getting any kind of care, I don't know what would happen to somebody like you in your practice, because you like to balance that and practice health medicine where it's integrating Western medicine with other disciplines.
Yeah, well, the problem will be is that you just can't make much of a living. And it's that way today. You practice out of the box, you're not going to get reimbursed by the insurance companies. And if you've got close to universal health care now, because so many more people are included in the government's programs, then it's going to be that the government's going to decide what they pay for and what they don't. So people who are trying to do complementary and alternative things, or people who want to listen to their patients, or to try to give individualized care, that's going to change.
Well, people are complaining now that their doctors are rushing them in and out, you know, like cattle.
Well,
move them in and move them out.
That's right.
But what's going to happen with conventional medicine, where they're not going to be able to have enough time to encourage people how to prevent disease? This is what we need, is prevention. Well, and if the doctors are rushed, they're not going to be able to really get at the cause of what the problems are either. They're going to be more just treating symptoms with their bag of tools.
Well, that's the same way that we're doing now in HMO medicine and in Medicaid patients now. There isn't enough time to do what you need to do. So you're right. The one-size-fits-all model is not going to be something that is going to be ideal for people. And if we're trying to do wellness and prevention and nutrition and natural therapies, there's not going to be a whole lot of time for that, although I'm sure there will be some plans for prevention as there are now, but they're not going to be major. So the system that we have is not really healthcare reform. It's more about insurance reform and about reimbursement. It's about money.
It's another reason why we need to all take responsibility for our own health and preventing disease ourselves.
Exactly. And see something in mind. Obamacare is trying to fix a few things. It's trying to fix the access to health care problem, which it's doing. It's going to be a burden on the middle class and a burden on the wealthy. The people who are indigent, don't have health care, it's going to be a boon. And of course they deserve that, because we all deserve health care. Second, it's supposed to reduce costs, but it's obvious that that's not going to be the case. If they cut back on some services, you may be able to cut costs, but you're going to cut the kinds of services you have too. And then there's a whole business of pre-existing illness. If you have a pre-existing illness, an insurance company can no longer keep you out for that reason.
That's a really good thing.
That's a big one. And coverage is not going to be going up, okay, when you get older or you have more health care issues that are there. And lastly, it's not going to influence the limit or the amount that can be spent in a year or in a lifetime. And then there was one last thing that had to do with recission, and most people don't even know what that is, but if you have, say, breast cancer that's newly found and you've been in the insurance company for a number of years, today a lot of health insurance companies are just kicking you out and say, go ahead, sue me. Now it's against the law. So there are some benefits for this Obamacare program, but we need to do what Vicki was saying here. We need to plan ahead, and we need to look at how we're going to change the healthcare system so it makes sense rather than getting a little bit on a piece of paper here that's crowded at the end.